Hey, discerning listeners, we have a very special guest on the podcast today, Dr. A. Levine-Ward, here to talk with us about nonviolent communication. I have had episodes on this topic before, but it's been a while, and I think it's a wonderful concept that really everyone should know about, whether it's in your relationship or at work or on the bus. It's a wonderful tool and principle to follow. Welcome to the podcast, Dr. A. Levine-Ward.
Thank you so much for having me. I am a big fan and was very happy to connect. So I'm really glad to be here.
So tell us about nonviolent communication.
Sure. So I think that often people, let's say outside of the psychology field, use it, as like a colloquialism, or we know it through TikTok or Instagram. The way that I think about it is a way of communicating that has 4 very specific components, and I'll talk about those components. Essentially, it was created by Dr. Rosenberg, 1960s, 1970s, and he created it actually as an opportunity to go into what he phrases as war-torn countries, particularly, for example, Africa, and mitigate tribal dispute. And nonviolent communication is the ability to resolve conflict in terms of what are we observing and can we say what's happening non-judgmentally. This includes observations. What do we observe? What do we notice is happening? What's happening in our environment? What's happening for us? Feelings. He uses the term feelings directly from the heart. What are we feeling, and can we say them in an I statement form? We can talk more about that too. Identifying what our needs are, which I think in therapy, I know at least as a therapist myself, talking about needs is huge. Being able to identify them is huge. And making a request. And again, your example on the bus, making a request. Excuse me, could you please move? Excuse me, I need to get out. Could you stop at this bus stop? Making a very simple request. The thing that I like to add onto this last component is that a request can be denied and it's not always met. So walking through those components with folks, and particularly remembering that we can express a need and a request, and that request might not be met, and then we have to deal with what that causes for us. Those are important components, and every interaction that I teach people about as it relates to nonviolent communication includes those 4 components.
Okay. So what do you do in your practice that uses nonviolent communication?
Oh, that's kind of that's a big question, because I think that it's everywhere. So this could be anything from what we would consider maybe intimate partner violence to I really wish my partner would want to wash the dishes, not just wash the dishes, but want to wash the dishes, and how do I communicate that to them, to I'm having a dispute with my boss and I feel very unheard and I would really like to stay at this organization or this company. And how do I both do this in a professional way and also communicate my need or make a request? So it's absolutely general. It could be applied anywhere.
Great. I'm glad that you brought up 2 examples. So the dishes one and the boss one. What might it look like to approach these situations communication-wise in a typical yet ineffective or problematic way versus the nonviolent communication way? What do those 2 approaches look like?
That's a great question. So first, I would say the maybe less helpful or the outside of nonviolent communication way might be saying what we are observing other people doing, or telling them what they are doing, or telling them how they are feeling. So, here's an example. I think you're not doing the dishes because you're annoyed, versus I am having a difficult week. I'm wondering if you're having a difficult week too. I see that the dishes aren't done, and I would feel very comfortable if they were done. I'm wondering how we could get that need met, or I'm wondering how we could get the dishes done by the end of the week. So there's a huge difference there between being objective and being non-judgmental in the second version versus being subjective and judgmental in the first version.
And what's an I statement? Did you sneak in an I statement there with the dishes?
Mm-hmm. So an I statement could be, again, if we go down this list, it could be an observation, a feeling, a need, a request that comes from our experience, could be a feeling that we are having, could be something that we are observing. It is without projection, without mentioning the other person, only speaking about ourselves. So an I statement could be, I've had a really long day and I know that I need to go to sleep early. The following request could be, how do you feel about us going to bed at 9:30 p.m.? And again, the request could be denied, but it's sticking to an I statement that is only about our own experience and not describing, projecting, or assuming what somebody else's experience is.
Okay. And do you ever get pushback from people saying that the communication style doesn't fit them, like it's too corny or something?
Oh, all the time. So one thing I kind of love that people say it's too corny, because my retort, and this is the type of therapist I am, I'm like, oh, okay, so lack of conflict and easy breezy communication is too corny then. And usually people will say, no, 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 So I try to kind of flip it on its head. The reason I love being asked that is because if we want to really talk about corniness and corny communication, the founder, Dr. Rosenberg used puppets. That was the original style of nonviolent communication. And so one could say it came from kind of a corny way of doing it. Or one could say, is it corny, or are we simply trying to make it accessible? And I try to reframe to accessible.
For the boss conversation, what does that look like? Ineffective or problematic communication versus nonviolent communication?
Ineffective, I would say, in a workplace could go one of two ways. It could be very reactive, angry, short, curt, not actually expressing our needs, pointing out what other people are doing. An effective way in a job situation might be showing and describing all of the ways that we are showing up, the way that we are committed to our job, the things that we feel we are doing very well, acknowledging possibly that what makes this different than a relationship in an organization, not all of our needs can be met all the time. Some recognition of that, and even maybe some recognition that the request might not be met, and that it feels important for the person who's speaking to their boss to speak to them about it, to be heard. But again, we want to, in this situation, veer away from being reactive, doing any kind of comparison, and making assumptions about why or why not our needs are being met. So I think the place that it might get tricky for people if they're listening to this is thinking about professionalism. And so that's why I add in this piece about not doing comparison, not being reactive, because in most cases, unless it's a very specific workplace, the thing we have to add in here is a different kind of relationship based on that professionalism.
Yeah. Do you use it in your own life? And if so, is there an example recently or a poignant example in your history that you were at the Y in the road and went the nonviolent route instead? I'm about to sneeze, I think, so I apologize in advance.
That's okay. It's pollen season.
No, it was like almost there. But is there an example from your own life that you said nonviolent communication and it helped?
Yeah. So I actually, as a therapist, but also as a person, I have taken a personal commitment to nonviolent communication and nonviolent behavior. that even means that if someone did a great job, I say you did a great job. I don't say you killed it. So there's these small ways that I engage in nonviolent communication on a micro level. On a macro level, a great example is I am a person with different sensory needs. And I was talking to someone, this is a couple weeks ago, and they were crinkling a potato chip bag while I was trying to talk to them. And I couldn't handle the stimuli of talking to the person and also having this crinkling bag. And so I turned to them and I said, I'm finding this conversation really important. I'm really enjoying sitting with you. I'm finding that I'm having a really hard time hearing you over the potato chip bag. Would it be possible either for us to have a snack now and continue the conversation, or put the snack aside and continue the conversation? And they said, oh, yeah, absolutely. Thank you so much for asking. And it's funny because in the rest of my life, outside of being a therapist, a lot of people know about my sensory needs. And so I will say, I really can't hear you over the car that's over there. Can we stop what we're doing so that I can focus? And again, it's just putting that responsibility actually back on me to name what's going on, and then name a need or a request and see if someone can follow up with it.
Mm-hmm. Yeah, I am that way with televisions. When I'm trying to talk with someone and a television is on, I just can't. I like, even if I tried my hardest, I would not be able to have the conversation. I wouldn't be able to keep my head straight. I wouldn't be able to hear really what they were saying. A notable example from this was I used to do in-home therapy, and I went into a house for the first time, met the client, and when you go into people's houses, you learn that there are a lot of habits that people have that are not your habits, or habits that you would imagine other people would have, because you just see them, and it's not like people go to work and say, I have this weird habit that I do at home. But when you go into people's houses, you see it. And one of the habits I would see in about, I don't know, maybe a third or half of homes was that people would just leave the TV on even though they weren't watching it. And that, to me, I just can't, I mean, each to their own. But I would come into people's houses, and there's this one house, first session, and the TV was right over her shoulder. And it was not loud, but, one of those giant TVs with lots of flashing lights and stuff. And I was in a habit of just politely asking from my own deficit, my own problem, like, I'm sorry, but I have a problem. I can't concentrate if there's a TV in my field of view, or if I be hearing it. So do you mind if you turn off the TV? And most people would just turn it off. But, well, there's one notable time, this woman just stone cold looked right back at me and said, nope, I'm not turning it off. And I remember it was so surprised. I was like, oh, okay. And this is the first session, so I'm trying to build rapport, and I did everything I could to concentrate, but it didn't really work. What could I have said nonviolent communication wise as a follow-up, if at all? I mean, maybe the best choice clinically would be to let it go, but if there was something I could have said, what could I have said?
Mm-hmm. That's a really good question. I think attempting to come back with a need or a request that's a middle ground. So, okay, if it's stone cold, I'm not going to turn it off. Okay, would it be possible to turn down the volume? Would it be possible if we move in a different direction, maybe a different room in the house, so that I don't have to see it? And again, you'll notice it's all I statements. And this comes back to one thing. This is not part of nonviolent communication. It is something I teach people about when I talk about nonviolent communication, which is radical acceptance. Radical acceptance means that we accept something. It doesn't mean that we co-sign, and it doesn't mean that we like it. And so if someone says no, and let's say we come back with a middle ground and they meet that, fabulous. If not, then maybe both parties or one party has to engage in some acceptance around the fact that I don't like this. This might be less than optimal for me. how can I take care of myself, or how can I move through this experience? So yeah, I think meeting in the middle ground and then doing a little bit of acceptance is helpful too.
Okay. So what other areas of nonviolent communication would you like to share with the listeners?
That's great. I think one of the things that's come up for me a lot, I am a queer identified person, is using nonviolent communication when we're talking either to family members or other people in our life who either don't believe similar beliefs, maybe who don't believe in the same political beliefs or agendas that we do, and how to have communication, and I phrase it this way, communication that doesn't implode or explode. And that's one thing that I like to talk to people about a lot, because especially in the time that we're in right now, and I don't know if this is your experience, but as a therapist, I feel like I'm talking to people a lot about who they're talking to and what they're talking about and how it makes them feel. And so nonviolent communication can be great in that area too.
Like, what's an example that you run into?
An example might be, so we're recording this, it's June 6th, we're in Pride Month. And one thing that might come up are parents, friends, loved ones saying, I just don't see the importance of why you would need to have a month. Or I just don't see the importance of why you need to celebrate this thing that makes you different. Can't you just kind of fall in line? That's something that I hear quite often. And again, going back to speaking to personal experience, not actually speaking to how that other person is behaving or what they are doing. And the other thing I would add in here is feelings and needs, maybe not even around agreeing with someone, but how we might want to be treated if we can't agree, or how we might want to draw a boundary if we can't agree. And I will say that usually the work and conversations don't revolve around getting someone to agree. They revolve around, so what do we do if we don't agree? How do we talk about that?
Okay. So is there any other things that you wanted to share?
I would like briefly to talk about the intersection between nonviolent communication and trauma, if you're okay with that.
Please, yeah.
So I work with individuals. I'm a trauma-informed therapist. I work with individuals who are coming out of surviving and building lives post-trauma. And this could be intimate partner violence. This could be, I help people who are coming out of high control groups or very fundamentalist religions, in which, whether it's a controlling boyfriend or a controlling church, learning how to express needs is something that gets suppressed in those situations. And nonviolent communication can be a great way to learn scaffolding, which is the outline or the skeleton of communication, so that we can start to rebuild those muscles post interpersonal traumatic event. Particularly the naming what a feeling is, that's a big one. Identifying that there might be fear around naming what those feelings are and expressing them, and identifying needs and expressing a request. I find that when people use these tools and are able to use them in stable or safe relationships, it can be very empowering, because they see that they can learn to advocate for their own needs post a traumatic event.
Like, in terms of giving the listeners an example of what that might look like in therapy, what might that look like in therapy?
Yeah. So I will go with a basic example that's non-religious, non-high control group. Let's say someone has a partner who, anytime one of them expresses a need, the partner says, I don't have time for that. You're too much. This is a big one. Your needs are too much. I can't deal with how big your feelings are. What happens is we internalize a narrative that says, I can't have needs. I can't express my needs. And if I do, either it's going to be too much for people or people are going to leave me. And so learning that in stable and safe and securely attached relationships, we can express our needs and it doesn't instantly get met with pushback is really powerful. And the opposite, which is we could express a need, we could express a request, and it can't be met. And that doesn't mean that either party has to be reactive about it. Also, very important.
Mm-hmm.
I do find for a lot of people, particularly people who have been assigned female at birth, or people who are very charismatic or very extroverted, one of the narratives that I hear a lot in therapy is I was told my whole life I was too much. And now I feel I need to make myself small in order to communicate or in order to get my needs met. And what do we learn when we do that? We are not actually getting our needs met. We are shrinking ourselves down, probably overlooking needs that we might have for fear of how other people might respond. And so, going back to your question about it being cheesy, I will have people practice with me in session with basic needs. So, here's a great example. I was working with someone this many years ago who was going to a concert with someone. They had previously, years ago, been in an abusive relationship, and in that relationship, they could not move about in the way that they wanted to freely. And so they were going to a concert, and they said, "Well, Doc, what do I do if I need to use the bathroom?" What am I? And I was surprised by that. I said, "What do you mean?" And they said, "Well, do I have to ask for permission? Is the person going to be upset that I'm leaving them? Should I just not go to the bathroom at all?" Again, we're talking about basic needs. And so we walked through what would it be like to say, I actually really need to use the bathroom right now. Do you mind staying here? Do you want to come with me? Identifying what the need is, saying what we're feeling in our body, and then providing options in terms of a request. And it went totally fine because hopefully, of course it did. And I think sometimes when we think about nonviolent communication, we think that it's going to be these huge conversations, or we think that, again, it's going to implode or explode. And so showing people that even learning this on a basic level, or, hey, I'm hungry, do you mind if I make dinner early? For people who've been in traumatic or abusive relationships, any expression of a need could be seen as a threat to the way that the system is working. And so learning to identify or re-identify our basic needs and express them without fear of retaliation is a very big kind of first step for people who are healing from trauma.
Mm-hmm. Yeah, that's interesting. And it, I think, might challenge some assumptions about what nonviolent communication is used for, because I think a lot of people might think, oh, it's about like toning it down and being more diplomatic. But what you're also saying is it's also a matter of zeroing in on your needs and being assertive, allowing yourself to communicate what's really going on with you and getting your needs met. It's not about you not being angry, It's about having a through line to your own needs and being able to communicate those in a way that is, caring but firm, right? Do I have that right?
Mm-hmm. Yeah, absolutely. And I will say, you use the word diplomatic. I think that is right on. I do think that a lot of this, again, if we think about its origins, it comes from helping warring tribes come to agreements. It is absolutely about diplomacy. And what I notice that maybe trips people up or makes them not want to use it is that if we only think about it in this very general, grand scale, it can be very hard to identify how we as individuals will use it. And so when we break it down to maybe a more granular need or a more granular request, then we can figure out how to use it in daily life, right? For example, the TV, a chip bag. These are things that we wouldn't necessarily associate with having to be diplomatic about. But if we talked about, I'd like to be able to move through life with less chaos, or I'd like to be able to move through life not feeling like I'm having difficult interactions on a daily basis. Okay, let's think about what are our basic needs? When do we notice they're not getting met, or when do we notice we're not expressing them? And that can be a really great place to start. I will also say there are some really great needs inventories that people can use. And by inventory, I just mean a long list. Because one of the things that I do want to mention is when people think about needs, I find that often they don't know what they are. And so using a list or bringing a list into therapy, or even, again, back to that might be corny, but sitting down with your partner and going through a list together of needs could be a really great place to start. Even if we're talking about just basic needs like doing the dishes, vacuuming, making dinner.
Yeah, absolutely. Speaking of chips and distraction, years ago, I was teaching and a student took out their sandwich and bag of chips, and I am, it's graduate school. We're all adults. Everyone is in their 20s, 30s, 40s, 50s, 60s. So I just trust that people will be able to figure out how to navigate that space. And so I don't have rules like in high school where you'd say you can't eat in class. It's like we're all adults here, like just use your best judgment. But this one student, in her best judgment, she took out the sandwich, and that was distracting, because the class is like 10 students. So it's not like you're in the back row of a giant hall. You're in a circle with 9 other students. And so she, and then she opens up the sandwich, she takes the top layer off. It's a submarine, like Subway sandwich. And then she opens the bag of chips, and then she starts dumping the bag of the chips into the sandwich. And then she covers it up.
I was waiting for you to say that.
And then she proceeds to eat it, and every bite was excruciatingly loud crunching noises. And I was just astonished. I thought, what do I do here? Because I don't know. I just feel like I'm not in the mindset of a high school teacher where I would tell someone to stop it. And in my head, it was comical and horrifying. And I had no nonviolent communication. I only had violent communication. So I just didn't say anything. But looking back, I could have used this. So thanks for coming on the podcast, Dr. Levine-Ward. Where can people find you online?
Yeah, sure. So I am a therapist at Seattle Counseling and Wellness. We are a group practice in U District in Seattle. You can find me there. I'm also a co-director of a branch in the practice called Community Partnerships, and I provide education and training to students, staff, organizations, anyone who might need it. And so we also work on creating what our name is, community partnerships, providing mental health care or mental health training to organizations that either want a one-time training or lecture or an ongoing relationship. So you can also find me there. Because I'm a therapist, I'm not hugely on Instagram for privacy reasons. But yeah, you can find me at Seattle Counseling and Wellness. And we are just a wonderful group of eclectic therapists. And if you are looking for a therapist, it's a great place to find one.
Great. Well, thanks for coming on the podcast. And everyone out there, engage in nonviolent communication for your sake and others, because you deserve it. You really, really do.